A tamoxifen effect on endometrial cancer. Okay, so what is tamoxifen? Tamoxifen actually is a drug that we can use in some kinds of what we call estrogen receptor positive breast cancer. Okay, so some types of breast cancers are estrogen receptor dependent or estrogen receptor positive. That means the more we have estrogen, the more we have growing of the cancer cells. Okay, so the cancer cell proliferation depends on the presence of estrogen. Estrogen binds with some estrogen receptors, okay, and this will lead to increase the number of the cancer cells. And the scientists thought about this in the way that we can put something that can block actually the binding of estrogen to its receptors on the breast cells, and tamoxifen was that thing. Okay, tamoxifen will bind to the estrogen receptor on the cancer cells, and it will prevent the binding of estrogen to this estrogen receptors. Okay, and in this way there will be a blockage of the estrogen receptors, and this will decrease the ratio of proliferation of cancer cells. So we call this an antagonizing effect of tamoxifen. Okay, antagonizing. So it's not an agonist; it's an antagonist for estrogen receptor in the breast. Okay, so this is in the breast. The surprise here that the tamoxifen can work as an agonist instead of antagonist in other tissues. Like what? Agonist, sorry. Like the endometrium. Okay, so tamoxifen can work as an agonist. You all know that endometrial hyperplasia and endometrial cancer depends on a large part of it on the estrogen. Okay, so the more we have estrogen, the more we have a hyperplasia of the endometriums. The same as the breast, we have some estrogen receptors in the endometrium, and when estrogen binds with these receptors, it will lead to proliferation of the endometrial tissue and to hyperplasia and cancer in some cases. Okay, the tamoxifen can can also bind to estrogen receptors in the endometrial and proliferate the endometrial tissue and lead to hyperplasia. Okay, so what to do in cases of breast cancer when we can't use tamoxifen because of risk of endometrial hyperplasia? Actually, we have some alternative class of drugs, which is the aromatase inhibitor. Sorry, aromatase inhibitors. Okay, the aromatase inhibitors are an alternative class of drugs. This works by blocking the peripheral aromatization of the androgens. Okay, because the postmenopausal women produce estrogen in that way. Okay, in the postmenopausal woman, the estrogens are made by aromatization of the androgens in the peripheral tissue. So if we block that process, this will lead eventually to a decreased risk of breast cancer by decreasing the estrogen. So this is about the relationship between tamoxifen and endometrial cancer. Thank you very much for watching.